Washington nursing home at epicenter of U.S. coronavirus outbreak lacks test kits.
And now we come to the thrilling final episode of our radio drama. Old Pete Belden.
The nursing home dealing with a COVID-19 outbreak in Seattle said on March 9 that it lacked testing kits for the 65 of its employees exhibiting symptoms of the coronavirus. Life Care Center is a nursing home in Seattle that has already seen 13 of its patients die of the virus. That's around half as many coronavirus deaths as there are in the whole of the U.S. The nursing home originally had 180 employees, but 65 of the employees are out sick while the rest are still caring for the 53 patients still in the home. A Life Care Center spokesperson said that they have been asking the government for more test kits. As of February 19, 26 of 120 patients at the facility passed away, with autopsies confirming 13 of them died due to COVID-19. Officials from Life Care Center said 31 of the 53 remaining residents have tested positive for the novel coronavirus. Seattle is a city in Washington, a state that has had 162 confirmed cases of COVID-19, the most for any U.S. state. The outbreak at Life Care Center only proves how quickly the coronavirus can affect the elderly in close quarters. This is especially true if they have other health problems and compromised immune systems. The Life Care Center spokesperson said some of their patients' health changed drastically, showing no symptoms at first to dying soon after. A couple of other nursing homes in Seattle have also been found to have a few coronavirus-positive residents and staff. The University of Washington School of Medicine has offered to test all Life Care staff for COVID-19. Nursing homes, also known as residential care centers or skilled nursing facilities, are places that offer a particular level of care that can't be provided at home. They cater to residents' dietary needs and provide residents with nursing care and activities to keep them engaged. Nursing homes normally care for the elderly and those who need end-of-life care, but they also often offer different therapies for injuries and illnesses. Some homes offer memory care units, which cater to residents diagnosed with dementia or Alzheimer's disease. English settlers first introduced the concept of nursing homes to America in the form of almshouses, which would give food and shelter to the elderly, the mentally ill, and orphans. Though almshouses benefited the needy, living conditions were actually very poor. This led to the creation of convalescent homes, which provided food and care in private. The government then turned these homes into public, permanent institutions to be funded by the state to ease the burden on hospitals. By the 1960s, nursing homes were a common sight in the U.S., and each one offered daily meals and medical care for the disabled and the elderly. The Nursing Home Reform Act of 1987 defined the services offered by nursing homes and paved the way for a resident's Bill of Rights. The nursing homes of today are no longer like the almshouses centuries ago. Now, they are equipped with Wi-Fi, TV, decorations, carpets, and quality medical care.